hello, Bay Area. You are listening to Radio Mirchi, 1310 a.m. And this is your one and only, bhai. This is the host who is gonna wake you up early in the morning for one and only, which is COVID awareness shows, right? So we bring up COVID awareness shows. This is the world's first one and only live two-way, interactive show on social media. Also, it goes on the radio. So we are very, very excited. And do you guys know that today is our COVID awareness show day 69, which is very, very amazing. And we also have a great topic today. So we have Dr. Modha and we have Dr. Ashok Rughani, who is a gynecologist and a sexologist, to chat on post COVID-19 sexual problems. A lot of times, we refrain ourselves from accepting and even facing our fears, right? We just don't want to discuss it, we don't want to face it. We want to be in a box, like, okay, કોઈને કહેવું નથી, કાંઈ શીખવું નથી, સમજવું નથી, હું જે કહું છું એ જ સાચું છે. આટલા વર્ષથી મને કોઈ પ્રોબ્લેમ નથી થયો, હવે શું થવાનું હતું? બટ ગાઈઝ, this is pandemic, આટલા વર્ષમાં તમને આવે તો પેન્ડેમિક આવ્યું તો તમને નો, right? You never had been in a pandemic before. And there are so many cases, even in youngsters that I've seen here, that it's more like, they only talk to their close friends and family and probably their therapist, right? And a lot of therapists have reported that they're really, really booked. You cannot even get their appointment. Can you imagine? And a lot of times people are having very, very personal problems related to their sex life even, and they can't even tell that to anyone. So we decided that, hey, let's break this barrier, let's break this stereotype, let's call somebody who has enough knowledge about gynec as well as from sexologist point of view. So if you know, I've added a hashtag today for the first time, which is sexologist se seedhi baat and seedhi baat no bakwas. What does it mean? Direct talk. We want to cut all the copy paste stuff. No reading blogs, no following on any social media taboos. Let's just talk directly to a doctor who has been practicing from so many years, right? So today I want to introduce Dr. Ashok Rughani. And he is a gynecologist, as I said, and a sexologist. And he's currently practicing as a consultant sexologist in Ahmedabad, which is in Gujarat, in India, since 2010. He graduated with DGO, which is Diploma in Gynecologist and Obstetrician, from MP Shah Medical College and Irvin Hospital, Jamnagar, in 1978. He completed his MBBS from MP Shah Medical College, Jamnagar, India, in 1996. And can you imagine, he holds a PhD in sexual medicine. I didn't even know that there is a topic, or you can even do PhD in this topic. But this is something which is really, really needed, especially for our generation, right? When people are really stressed and they only prefer a lot of other options, right? So yes, he has done his PhD in sexual medicine from one and only the city where I belong from, right? Where I live in, which is San Francisco, California, USA, in 2004. He has been practicing as a gynecologist from 1980. Oh my God, I was not even born then. And then he started his sexologist practice from 2008 onwards. And he has a vast experience, not just, in India, but in countries like United States and also in Kenya. So he's a very, very, successful doctor who has known these different countries and studied at these different places, right? And especially San Francisco. So today this topic is very interesting, and I do want to highlight a little bit about this taboo which is going on about sex talks across the world. Hey, koine kehvai nahi, koine bolai nahi. But we want to get away from it. It should be like you, me, and the doctors talking very normally, right? I can't imagine that I'm talking this on social media, but I mentally prepared for this show, and I was like, no, I'm gonna send this message, like this message આ મેસેજ જવો જોઈએ બધાને જ વર્લ્ડમાં, રાઈટ? નોટ જસ્ટ ફોર પીપલ ઇન ઇન્ડિયા ઓર યુનાઇટેડ સ્ટેટ્સ. Why there is so much taboo? Why there is so much stereotype? Why can't we face our fears? A lot of people ask me, hey, vaccine લેવાથી કંઈક reproductive systemમાં કંઈક થઈ જશે તો what are we going to do? We can't tell this to our parents. And I was like, okay, then who do you want to tell? So all these fears, let's discuss it in our today's show, and we will bring this awareness. And that's why hashtag, remember, seedhi baat no bakwas, right? So if you wanna like really spread awareness, use this hashtag. And yeah, no gossip. We'll directly talk with our sexologist, who is Dr. Ashok Rughani and Dr. Modha. So now it's time to call our most famous doctor in Rajkot, in India, I think in Gujarat, which is Dr. Modha. Now he's a global doctor. And we gonna call him as આપણે એમને કહીએ જ છે ભાઈ સર્જનોના સર્જન and Bhishma Pitama of surgery. So we are going to call Dr. Prakash Modha, as the tradition goes, so that he can come on the show and share with us COVID statistics, like a world COVID statistics. Then it will be India, Rajkot, and him's favorite country, which is Australia. So let's call Dr. Modha and welcome Dr. Ashok Rughani on the show. Hello.
Yeah, good evening viewers in India and good morning viewers in US. I welcome Dr. Ashok Rughani, who is a good friend of mine, childhood friend of mine. We have studied together in Porbandar, and then we were together in Jamnagar doing MBBS. Then Ashok did DGO and went to Kenya, and I did my MCH, went to England, come back to India. So this is the story, but Dr. Ashok Rughani is one of the best sexologists known in Gujarat as well as in our Saurashtra and Kutch area. So we welcome him, and then I'll start with the corona statistics. In USA, the COVID-19 cases are increasing. It is 84,735 new cases in US and 501 new deaths. UK, the cases are coming down. It's 25,402 only, and new death is 127. Coming to India, it is 43,509 and 614 new deaths. Going to Brazil, the cases are also coming down. It's 48,013 new cases. But death is very high, 1,344 deaths. And as far as Australia is concerned, there are 205 new cases and only 2 deaths. Now coming to Gujarat. Today is a great day. Gujarat has got only 28 new cases and no new death. So that's the things to be celebrated. Ahmedabad has got 3 only new cases. Surat has got 8 new cases. Baroda has got 4 new cases. And we are proud to say that Rajkot has got 0 new cases. There is no new cases in Rajkot.
Excellent.
Bhavnagar has got 1 new cases. Jamnagar and Junagadh also has got 1 new cases. So corona in India, in Gujarat, by and large it's coming down. But do you know Kerala and Karnataka? They have a recent case of corona, COVID-19, and practically it's half of the total India's cases from these 2 states. So we are a bit worried about this thing. And mucormycosis, we are not seeing the new cases of mucormycosis, but we are seeing the complicated cases of mucormycosis, like osteomyelitis of the skull bone, osteomyelitis of the chest ribs, and so many other things, complication of mucormycosis. But there are no new cases of mucormycosis in our region. Then about the vaccination we go. Vaccination is day by day, it is increasing, and almost 22% of Indian population had one dose of vaccination, and almost 10% of the Indian population has got two doses of vaccination. So vaccination is increasing, and my request to all our viewers who are in India, so I just request them and pray them, please go for the vaccination, get yourself vaccinated to fight the third wave of COVID. So this is my humble request to all my viewers, go and get the vaccine. So with these remarks, I'll request Dr. Ashok Rughani and Ishita to carry on forwards about the question to Dr. Ashok Rughani, who is the well-known sexologist of our region, and let us see what he has to say about the COVID and sex problem.
Thank you, Dr. Modha. But before we start the question answer, I want to know that why we are seeing so many cases in US, and then why in Brazil there's so much of death. What are your thoughts on this? I mean, is this really third wave? Is this gonna continue? Yes.
See, I will tell you about the COVID cases increasing in USA because people are not wearing masks.
Okay.
Uh, they go on the beach, go in the restaurant, go in the movie, and they are not maintaining social distance, not wearing masks. So these are the two common cause for increasing the case. But the severity of this case are less, and the mortality means death rate is very low. So this is the main reason that COVID is increasing in US, and school has already started.
Yes.
Colleges are open. So people get together, they go together, they go for movie, go for the dinner, and go for the party in the evening. So these are the few common causes which causes increased cases of COVID.
Okay. Let's hope that
What do
there
you
is.
say, Ashok?
Yeah.
True. I agree with you.
Okay. Dr. Modha, can you?
So I
Hello.
can hear you, but I am not able to hear Ashok. Yeah.
Hello.
Now, yes.
Can you hear me?
Yes. Good. Yeah. Certainly. Good. So
Okay.
let us begin
Let's start
with
with
the
the
questions. Yeah, please.
question. So, one important question, and a lot of people have asked, discussed after that, khusur khusur and gossip. This question has come along, and that's why I want to ask about sexual problems after COVID infection. Is it a common thing?
Hi. Good morning to USA listeners and good evening to Indian listeners. My name is Dr. Ashok Rughani. I am practicing as a sexologist doctor in Ahmedabad, India. Let's talk about sex without having any fear or without having any shyness or without having any taboo. Now, sex is a very important part of a human being, and there is no expiry date of sex. So, now COVID infection and sexual problems, definitely we have started seeing more and more number of patients, mainly male patients after COVID infections, they are getting more sexual problems. Now the statistics showing, and it is too early to talk because it's 1 year and 6 months, but still what reports we are getting, initially the COVID infection was at very high rates in Italy. And a lot of studies have been done in Italy, in USA, other parts of Europe, in some parts of India also. The number of male patients are increasing with complaint of erectile dysfunction after COVID infection. And one of the statistic is showing, which is kind of surprising, that the number of erectile dysfunction patients increased 6 times after severe COVID infection. 6 times. Actually, it's 5.66%. That is the figure from Italy. But
Dr. Ashok, one of the listeners is saying if you can be more louder, that would be better.
okay. So the number of patients are increasing after mainly after severe COVID infection. And also there is a reason behind it, because most of the patients who are getting COVID infection, mainly serious patients, have some comorbid condition. So comorbid condition is also common. Erectile dysfunction is common with comorbid condition. So let me just mention a few conditions: diabetes, hypertension, obesity, depression, high cholesterol levels, hypothyroidism, low testosterone, stress, tension, worry. These immunocompromised patients like HIV patients or some other immunocompromised patients or autoimmune disease disorders patients like rheumatoid arthritis or Crohn's disease or ulcerative colitis, and then many more. These kind of patients have a less immunity to fight against the infection. And these are the patients who are getting more sexual problems. Now, let me give you a little bit idea about why patients are getting more problems after COVID infection. See, COVID infection is causing inflammation of the body's organ. The first organ which is affected is lung. The second organ which is affected is cardiovascular system or heart and the blood vasculature or arteries. Now, it causes inflammation to the small arteries. Inflammation leads to narrowing of the small arteries, and because the vasculature of the penile arteries or penis arteries are smaller compared to heart and other arteries. In real sense, the penile artery is 1 millimeter in diameter. Heart arteries are 3 millimeter in diameter. Carotid arteries on average is 6 millimeter in diameter. So the first part which is going to affect after inflammation of the arteries is penile arteries. Once there is inflammation of the penile arteries, there is less blood circulation to the penile part. Once there is less blood circulation to the penile part, they get difficulty in erection, and that is called in medical language erectile dysfunction. Now, other cause of erectile dysfunction and sexual problems are psychological trauma. After COVID infection, people are lonely in the quarantine for 2 weeks or in the hospital. They are kind of lonely. There are a lot of stress related to the sickness, other stress related to financial problems, other stress related to they are having some other issues with the family members also, because sometimes this pandemic affects all your family. I have seen
Mentally,
so many.
emotionally, financially, socially, I think it impacts 360.
Right. And the another point is, in sexual point of view, the biggest organ of the sex is our mind. So when you are mentally disturbed,
Mhm.
when you are under stress, tension, worry, you are disturbed, you don't know what will happen tomorrow, it's going to affect your sexuality, because you can only enjoy your sexual life when you are mentally free. So otherwise also, without COVID infection also, the most of the people with sexual problems, also there is a psychological problem. So it's biopsychosocial problems. That is how we call it in medicine. Biopsychosocial. Most of the sexual problems are related to biological problems, there is medical problem, psychological issues, and social issues. We can discuss all
Yeah,
these things one by one, but that is how the more sexual problems after COVID infection.
right, right. So, thanks, Dr. Ashok Rughani. Next question is then what are the most common sexual problems?
So the most common sexual problems after COVID infection, number one is erectile dysfunction. So erectile dysfunction means difficulty in getting good erection. The second most common problem is loss of libido. Loss of libido means the sexual excitement and sexual desire level goes down. And the major cause of loss of libido is, one is after COVID infection, this virus loves these tissues, testicular tissue also. So it's affecting the male testicles, unfortunately. The way it is because the damage of the lungs, it causes damage to testicles also. Now testicles are the one which is major source of it produce the testosterone, which is a sex hormone. There are a lot of studies done, and one of the study was done in USA. They have tested the testosterone level after admission of COVID patients after 3 days, after 6 days, after 9 days, after 12 days. In each time, they have noted more than 50% patients' testosterone level went down. This study was done in St. Louis City in a medical college, Washington. It's called Washington University. This was the study done recently. And they have proved that the patients with severe infection are getting low testosterone eventually, and that affects their sexual desire level, because the testosterone is a male sex hormone. If you have a less sex hormone, you don't feel like making love, or you don't feel like sexual excitement, or you don't feel like doing sexual activity. So these two major, one is erectile dysfunction, the second one is low testosterone. It's called loss of libido. The third one, it affects to some patients, which we don't know, long-term study we have not seen, that it can affect the fertility of the male and female. Now, fertility affects in male is because of the two reasons. One is he cannot function well, so naturally he will have a problem with the fertility. The second is low testosterone level also affects the fertility, because testosterone is important part in the sperm production. And the third thing, because patients are under stress, tension, worry.
Yeah.
Okay. The other study was done in Italy. They have done some postmortem examination of a male patients, and they have found COVID-19 virus infection even in the benign tissues, even in the testicles. So one study was showing that some male patients after COVID infection, they pass virus in the semen. Now this is still at too early stage to tell. So we don't know the future, because long term we don't know the outcome. But I would advise as a doctor that after COVID infection, if somebody, a young couple is been trying to have a baby, I would advise them to hold on for at least 6 to 8 weeks.
Okay.
Use protection at least for 6 to 8 weeks, because we don't know what kind of percentage or what kind of number of virus they are passing from the semen. Without using condom, if they have a sexual intercourse, they might pass those virus to female partner. This is at very early stage, but this is one of the belief that it is better to be on preventive side and use the condom.
So, thank you, Dr. Ashok, for giving the most common sexual problems. I'd like to go to Dr. Modha and ask and seek his comments here. Dr. Modha, any comments here? Have you seen some patients' complaints like this, or your opinion?
Yeah. I will draw your attention, Ashok, that if the pregnant woman deliver a child, pregnant woman with a COVID, deliver a child, and she is breastfeeding the child, then the child is not getting the COVID.
Right. Yeah. That study is not. Yeah. But you are right. They say that you can breastfeed your baby after COVID infection, and the virus they have not found in the breast milk. That's the. But to have a baby, because
they found the virus in the semen.
Yeah, it might be in the semen. We don't want to take a chance, and it is better to use contraceptives, mainly condom as a protection to avoid the transmission from male to female partner.
All right. Thank you, Dr. Modha. So then the next question I think a lot of people would like to discuss or know is about this loss of libido. And a lot of female partners complain that there's always this low sexual desire. Any comments or advice over there?
Okay. So the loss of libido or less sexual desire, the major cause. I'll give you the brief idea why people have a less sexual desire, first of all, and then we talk more. See, sexual desire is related with three things. Relationship of a partner. So somebody, a married couple or a boyfriend and girlfriend, if they have a healthy and happy relationship, is very essential part of a sexual excitement and desire. So point number one is relationship. Point number two, mind. You should be mentally free. You should not be under stress. There should not be any pressure. Now let me give a little bit more idea or more open. See, people have so many myths about size of the penis, right? So male partner should not have that kind of fixed mind that, oh, what will she think about my size of the penis? Because this is a big thing, probably every parts of the world. You see so many emails, penile enlargement therapy, by watching a lot of pornography, they think that penis should be big in size. Let me just tell you very truth. I receive minimum 20 telephone calls or a message by email or WhatsApp that I want to increase size of my penis. Now, this is the real fact of every day in India, in Ahmedabad. I'm talking. If somebody can understand the size of the penis doesn't matter, function of the penis matter, it will help them a lot. Now, one study was done in India, and this is a very interesting study. It was done recently by one doctor in South India. He asked 2,000 couple, 2,000 female, that does size matter to you in your marriage life? And can you imagine 90% patients, 90% female, not patients, but female, told him that no, it doesn't matter to us.
Wow.
So according to me, as a doctor and as a sexologist, I believe most of the female don't think about size of the penis. They think about the function of the penis. They think about the relationship of the person, and we need to have a relaxed mind. You should be out of the phobia, fear of size, and you should not have any worry about your relationship. Now, so that is one another cause of loss of libido. Mental stress, tension, worry, myths. The third thing, if you are healthy, then only you can enjoy sex. See, so any medical illness leads to loss of libido.
Oh.
Now, so many patients are anticipating failure. You see, he doesn't have a confidence, lack of confidence. See, when you don't have a confidence, you cannot enjoy sex life. So to have a happy and healthy sex life, this is what I would advise. Keep your health. You should be health conscious. Don't be obese. Do regular exercise, because exercise, any kind of exercise, is very important. Exercise helps to increase your testosterone level, scientifically proved. Exercise increases blood circulation, microscopic blood circulation, so you get better blood circulation in your penis part also. Exercise reduce your obesity and weight. Now, obesity is also a leading cause of sexual problems.
Oh, wow.
Because obesity means metabolic disease. Most of the obesity patients, most of them have either diabetes or hypertension, or they have a high cholesterol level, and this leads to body syndrome also. You think that, okay, I'm telling you another thing, that you see, bigger the abdomen, you have less sex. This is kind of not a medical language, but I'm telling the truth. In the sense that you get less blood circulation of your penile part, and you cannot enjoy sex when you are obese. Even I believe that probably your partner might not enjoy when you are very obese because you have a heavy weight. But otherwise also, the bigger the person, their penis size also looks small. So they have also that thing in the mind that, oh, I might look small. In reality, it's not small,
True.
but because of the obesity. Now, obesity causes so many other problems also, which everybody knows. So to have a good libido, you should be physically fit, you should be mentally fit, you should have a happy and healthy relationship with your partner. I would say, add another point, open communication is very, very important in sexual relationship. You should be very open with your partner. You tell the truth. At the same time, you give her good information and tell what is your fantasy, what do you feel, what do you want, what you don't like, what you like. Discuss with your partner about fantasy, about the reality of life. See, hyper expectations are very high sometimes in both partners, unfortunately. Now, I'm just giving you the example. This is the real story. You know, these days, even in India, the extramarital affairs are also very common. Or even unmarried girls have a two, three boyfriends or five boyfriends. Now, what they do, they compare. Oh, the other friend of mine had a sex with me for 15 minutes and you just finished in 3 minutes. Now, can you imagine? You can finish anybody by telling this kind of statement. You because it causes you mental trauma. You become depressed. You lose the confidence to make love next time with that girl. You will never go back to her, or you will probably never. You will be afraid even to make love with anybody. So mentally, you support the person, male or female, is very important. You have to support them. You need to be open with them rather than talking something which is not the right thing, but what you have heard in pornography or what you have listened or watched in pornography. I am not against pornography. I think pornography might help also to some people to learn this, other stuffs. But to me, excessive pornography is really harmful. It has we in our practice also see many patients by watching excessive pornography and leads to masturbation, excessive, may lead to sexual problems in future. And this is research done by many doctors in USA and other parts of the world. I mean, we see in our clinical practice, scientifically certain things we cannot prove it, but in clinical practice, in real practice, we see many patients, especially young generation these days, because everybody have a mobile phone, or all the time they are sitting on the computer. So when they are getting tired, they just keep on watching pornography. And after watching pornography, they do masturbation. Now, masturbation is normal and healthy, provided you do when you have a real urge to do. That is fine. I'm not against masturbation. Masturbation is normal and healthy. Somebody should do masturbation. That is fine. In fact, it is good practice. Even for female, masturbation is normal and healthy. But to do masturbation all the time by watching pornography can cause also sexual problems. Now, once you get this problem, you lose the libido. So that's the reply I'm telling you. The loss of libido have got multiple reasons.
Reasons.
It is a relationship problem, mental issues, and your body, healthy life, mind.
So the next important, I think, but we are getting a question from one of our listeners. I'd like to address or take that. So the question is from Upendra Singh, and he's asking that we are also suffering very big financial problem. How can we relax mind every time thinking about that problem? It's not possible to have a relaxed mind.
Very interesting subject. Very interesting question. This is how I will reply you, my friend, Mr. Upendra Singh. Listen, there is nobody can have no problem. I mean, people do have problems in their life. So you need to learn to digest the problems. You need to learn to live with the problems. You need to do yoga and meditation. Helps a lot. Learn to relax. Learn to relax. Read certain things which are more positive. in the life. Now, by worrying, it's not going to solve your problem. In fact, stress and tension increases our problem. I agree. But at the same time, if you learn to relax, sex can relax your mind, my friend. But to relax and to have a happy and healthy sex life, yeah, you need to learn so many things. Like what? You do regular exercise. Exercise also relieves your stress. Exercise is one of the major benefit of exercise is relax. It relaxes your mind, right? When you especially go for a morning walk or evening walk. And if you walk with your partner, it relaxes you more because you walk with your partner, you discuss some things, and during beautiful weather like the way we have now in India, you enjoy it. You become fresh. Meditation and yoga, I strongly believe, also helps a lot,
Yes.
especially meditation, to learn to relax your mind. And that is the meditation probably. I'm not very expert in meditation, but that's what I have learned. So, and financial problem you cannot solve by having worry. You, whatever problem you have in your life, you try to solve the problem. That is what my philosophy is. And if you cannot solve, leave it to God. God will help you to solve the problem. Trust God. Have confidence in somebody. Okay? And you cannot have a confidence in human being, then have a confidence in God. God will help, but you have to work hard. You should be very honest, first of all, and then work hard. Honesty pays you back.
Excellent answer, Dr. Ashok. I have seen so many people in India have no money, but they have great sex life, and I feel like how cool, right? They don't
That's
really
right.
care.
That is the main reason I live in India. I'm a US citizen.
Oh,
My family lives in USA. I love
Very
India.
good, very good.
I love India. I mean it. Don't think that I'm against the USA people. I love USA is a great country, but in real sense, personally for me,
Yes.
I enjoy India. And even same to Dr. Prakash Modha. He knows me. When I moved from USA, I met him first in
Yeah.
Rajkot, and he asked me, "Why are you moving?" Because he knows my lifestyle. He knows me personally. We have been childhood friends. But this is, India is a great country. If you want to do the right things, this is one of the best country in the world. If you want to do the right things, you can do the good thing. You can enjoy the life, and well, it's a beautiful country.
and one of the shocking research was done here. They need a lot of egg donors. They are getting from India. A lot of
Okay.
egg donors,
Oh, that
donors
is
from India
because of the money.
because of
But
the.
that's
You
fine.
see, Ashok, I came back from England because one of the reasons was this, and another reason was my mother. That I come back to India.
True.
Through Prem,
Very true.
Baba.
Yeah, good. No, that's very good.
Yes, yes,
Family value, family system, our family system, social structure of India is such a nice that people get less depression in India
hmm,
because of the family structure, because of the society's support. So these are the positive points in India. Everybody knows Dr. Prakash Modha in Saurashtra. Everybody. He goes anywhere, everybody knows. And especially in Porndar, he's the son of Porndar. So everybody knows him like that. Those kind of love, pure love, you don't get except India.
yes,
Yeah.
it's true. So, I think next question, Abrilaye, which is about. I think we covered most of it, but if you have any comments on, how to work over erectile dysfunction and the fertility issues that
Sure,
people see these.
sure. Okay, fine. So let me give a very important statement first about fertility along with COVID. Unfortunately, so many parts of the world, and even in India, people have started talking nonsense about vaccination and fertility. So I want to clarify as a doctor, vaccination doesn't harm you in your fertility at all. No studies have seen. This is the studies I'm talking. I'm not a politician, but vaccination definitely helps you. My friends must take vaccination, as Dr. Prakash Modha said. Second thing, it is not going to affect your male fertility or female fertility. So vaccination will help you. We have seen many people died in the hospitals because of the COVID second wave in India, and it is very bad. So, for prevention, you can only prevent COVID infection by following COVID protocol. Use always mask. I use 2 masks. Social distancing very important. Even there are parties going on in the bar or restaurant and wedding party, avoid it if possible. Indoor parties are really bad. And third thing, vaccination. 2 doses. Whenever you get chance to get vaccination, well, take it. India is a poor country with 130 crore people. Still, government is doing excellent job of trying to get the vaccine for the people, and it's free. It's freely available. If other developing countries are looking for vaccine, they don't have vaccines. And in India, we are getting free vaccines. So please take the vaccine. So that's just one side line. Okay, let's talk about erectile. How should you go about erectile dysfunction? Okay, so erectile dysfunction means difficulty in getting erection. Now, there are multiple causes of difficulty in getting erection because of the post-COVID. Let's talk about COVID. So most of the patients with COVID infection, the erectile dysfunction, as I mentioned to you, it is because of the damage of the blood circulation. Number 1 cause. Second is microcoagulation. This is a medical language, but microcoagulation and inflammation of the tissues. Okay, so that one you have. Some other comorbid condition, please control it with diet, exercise, and consult your doctor. Get proper care for diabetes, hypertension, and any other medical illness. Very important. See, a lot of patients have been given steroid medicine during COVID infection. Steroids, which is true, which is, well, they require it. That's why, and it has saved so many patients' life. But steroid also causes less testosterone. That is one of the side effects of the steroids. So it's just unfortunate. I don't want to blame anybody, because when there's a question of life and death, steroids can save the patients, right? So that is fine. But because of the steroid during COVID infection, it also affects their sexuality in certain percentage. But that's fine. Now, line of treatment. As a doctor, on the telephone interview or something like Facebook time or something like that, I cannot mention that, okay, take this medicine or take this medicine, because that is very much doctors should prescribe. But broadly speaking, and very frankly speaking, there are some good medicines available in this world which can really help you to improve your erectile dysfunction. So you must consult a doctor rather than having a shyness or having problem at home, because there is a problem. If you cannot perform sexual intercourse with your partner or with your wife, well, you will develop problems. It will cause you psychological trauma. It will make you depression. It will cause depression to your female partner. Plus, then other issues, social issues, extramarital problems. All these problems can lead, because if you don't keep your partner happy. Now, if medical treatment is available, most of the patients can be treated and satisfactorily with the medicine. Do not afraid to consult a physician or a doctor. Mainly people who are specialized in sexual medicine can help you more. But if the doctors are not available, like all the places you don't get sexologist doctor, then you can consult even a physician or your family doctor. Definitely they can help you. But to speak non-medical things, I can give you some idea. Eat healthy food, be positive, go for regular exercise, diet, have open communication with your wife also, that listen, I have a problem after COVID infection and I would like to consult a doctor and we can go together, and you support me and I should be fine in a couple of weeks or a couple of months. Most of the patients might need medicines. We don't know for how long. See, because we don't know how long the damage will be made. That's the unfortunate part at this time. So I'm telling the truth that most of the patients, I have seen many patients in my practice after COVID infection. Some have recovered. Mild to moderate patients have recovered. But some who are having so many comorbid conditions, they have recovered or they are doing well, but they need medication. But it is fine to take medication. Medicine is not going to kill you. Medicine is not going to cause you heart attack. These are all myths written in the newspaper or some books. But in medical sense,
Messages, right? Right? Don't do this, don't do that.
no, don't take the medicine by yourself. That's the point
Huh.
number one, which is very common, unfortunately, in our country.
Yeah.
But you must consult a doctor and let doctor prescribe you, and then you take medicine and enjoy your sex life. My friend, enjoy your sex life, which is very important part of a human being. According to me, majority of the divorce cases related to sexual unsatisfaction. Unsatisfactory sex life leads to depression, it leads to divorce, it leads to extramarital affairs, it leads to so many problems.
So, thank you, Dr. Ashok, for this amazing advice on erectile dysfunction and fertility. But I think the next question I have, and I think Upendra Singh is telling us, thanks to reply me and my question. See, live feedback. Next question is, when could a couple start sexual relationship after COVID infection?
Okay, that is very interesting question. Now, see, lot of studies have been done, as I mentioned you in the few minutes ago, that a male can pass some kind of virus, so few virus in the semen. So advisable, if you are healthy after COVID infection, you can have a sexual relationship with your female partner, but please use condom protection for at least 4 to 8 weeks. So that is the advice. Now, if you are planning for a baby, also you can wait for a few more weeks and then consult your gynecologist or your doctor and then plan for a baby. So that is my advice.
All right. Dr. Modha, any comments here?
Absolutely correct. And particularly young couples should notice this, that you should follow the Dr. Rughani's advice about the sexual relationship and having a planned pregnancy. This is very well said by Dr. Rughani because nobody is clear about this. So at least after 6 to 8 weeks, that is a reasonable good time, and one should or couple should have a discussion among themselves and then plan pregnancy after 6 or 8 weeks. So that will be they are having a good child in a future. But because otherwise they might abort or child may born with a COVID infection. This there lots of problem can happen. So be safe to be on safer side. Play safe and with a condom, sex with a condom in an early part. And when you planning a pregnancy, have a after at least 2 months, roughly 4 to 8 weeks is very well time to have a planned pregnancy. That is what Dr. Rughani says, and I do agree because I was not knowing this. I am very much happy that we come to know we can advise somebody at least. So thanks to Dr. Rughani and very well said and keep it up. That is my request.
So, thank you, Dr. Modha. Next question we're going to take is, what about post-COVID trauma? It leads to multiple issues as you discussed, but then how to avoid or recover from post-COVID trauma?
So I give you my personal experience. I had COVID infection in July to, last year, 2020. It was the first time in my life, to be very frank, I was feeling unwell for 2 weeks, continuous fever, no other symptoms those days, but I was really depressed. The reason is you are alone in the room, number one, then you don't know what will happen to your life tonight or tomorrow night. So many, as a doctor, we hear so many stories. So many people had a severe, pneumonia or heart attack, and they have gone to oxygen level has gone down at night. They have
Yeah.
to rush to the hospital. Sometimes there are beds are not available in the hospital. So the COVID infection leads to so many trauma. But I came out by, I used to talk with my friends, doctor like Prakash and other doctors on phone every day. I used to get advice from a physician who, they used to tell me. So you talk with the doctor, you talk with your family. My wife was she's a registered nurse and excellent human being. She was supporting me. Always I was on phone with her, but I was in isolation. My children from USA were advising me. So, like, this is the common for everybody. Every family support is very important after COVID to avoid the trauma. That is point number one. Point number two, I can understand financial loss, but whatever loss you have done, you are not going to recover. So be positive. Try to now, go slowly in your business or in your profession, and you will make money. Life is not just finished by having not work for a month or two. That is number two. Number three, once you have been given advice by your family doctor or your physician, go for regular exercise. I go every day 1 hour walking 6 kilometers in Kanavati Club in India. Every day I walk 6 kilometers. Morning half an hour, evening half an hour.
Excellent.
You need to be healthy and happy. Be positive so you are happy. And go for regular exercise, control your diet. If you are drinking alcohol, drink in limited quantity, not more than 2 packs. Don't smoke. Let me tell you very frankly, smoking is very harmful for sex. People who have been smoking, then they get lung damage and the chances of COVID infection are more. So tobacco chewing is very common in our country, unfortunately. Mawa khawana band karo. And don't smoke. Smoking, tobacco, and alcohol. I mean, alcohol is okay to drink in limited quantity, but limited.
But
Limited means
see, the thing is,
not more than 2 packs.
that's what, right? When you start drinking, your friends will be like, "Haji ek pack, haji ek." એમાં
So
પછી ખબર ના રહે, right?
you
લોકોને.
have to control, but you have to control. So that's the advice. So you get social, support. Be positive. So yoga and meditation helps there also
Hmm.
to come out from the trauma, because that is what the life is.
Right. Dr.
Well,
Modha,
I wish everybody good luck. So that we hope that we don't get now next, third wave or fourth wave. We don't get in India or in US or every parts of the world. Unfortunately, the number of patients in USA are increasing, and as doctor said, people don't use mask, and so many people in USA I know are not ready to get vaccine. Unfortunately, but I cannot say much to them. But I request anybody who have not got vaccine, please go and get the vaccine in US or in India or anywhere.
yes. Dr. Modha, what are your comments about this drinking and smoking and all these side effects?
Let me first let me tell about the family support.
Okay.
Really, to recover from the COVID, you see, one of my, Mr. Vaibhav Dave. I
Yes.
should not name it, but he's one of the good staff,
Yes.
and he had a COVID. So he was worried about his family, his kids. He was worried about his mother, father, what will happen to them. So that thing, sort of a thing, if family is talking to you or they are nearby to you, that will reduce your worry. That don't worry, we are there. So this will reduce your mental stress and help in recovery. Now coming to the second point about the smoking. Smoking is worst causes your arteries to become narrow, less blood supplies. Sometimes you get stroke, sometimes you get infarction, sometimes you get some gangrene in the legs, and so many things happen with smoking. So I'm of the opinion that smoking is not helpful, but it is harming. But there was a one study in US only that smoking causes irritation of the bronchi and bronchioles, and they produce a secretion in the bronchus, and they are resisting to get virus into them. So they are avoiding the COVID in a smokers, but it is only one study which is still I am not well convinced, but they have said that if you smoke, your secretion is there that will not allow virus to enter in your body or into your circulation. So that is about the smoking, one comment. And now about the alcohol. So alcohol in a moderate amount, as Dr. Rughani says, 1 or 2 pegs is enough. And that will help you to increase your circulation, to dilate your vessels, and to avoid you from heart attack. But drinking more than 3 pegs, 4 pegs, 5 pegs is dangerous. And apart from this, if you don't do exercise and just go on drinking, and you increase your cholesterol, it increase your sugar, everything goes against you. That might produce some other heart attack or some infarct and paralysis, like sort of things we develop. So over alcohol is dangerous and should be avoided. Always alcohol in moderate amount, that is a 2 packs, is enough to get. But when you are in a crowd, you are in a party, they say take one more, and you go mad with the alcohol. So that thing should be avoided. Uh,
I
and exercise.
I want to
Sorry.
interrupt you there, Dr. Modha, because I was just talking to a friend last weekend કે તે આટલું ડ્રિંક કેમ કર્યું કે તને ખબર જ ના પડી તો કે see it started with 1 pack then 2 and then પછી તો ખબર જ ના રહી કે કેટલા પેક થઈ ગયા મેં કીધું કેમ તો કે એક and that's what happened and then I'm like how can this be possible you can't track your own alcohol packs 2 પેક પીધા પછી ખબર જ ના રહે કે કઈ દુનિયામાં છે કે how can I track બોલો
Yeah, that is right. That is right. So that is why you should drink in a moderate amount so that you are not under the influence of anybody.
yeah
And that's why you can save your life. And the most important thing I will stress
huh.
is yoga, anulom vilom, vastrika, and exercise. Do more exercise, go on walking, do even exercise, go to gym if possible, whichever way, or get yourself in a group and get together and do exercise together. That will boost your morale also. So these are the few ways you can avoid COVID, or you, if COVID happens to you, you can come out very fast. So these are the few things I would request to our viewers, that please do this thing and save yourself from the COVID. Please do take vaccination. Don't avoid vaccination saying that, oh, it causes some impotency. Sometimes they say it causes paralysis, or sometimes some woman says, oh, it's no good. Let me die. I don't want to take vaccination. This is all rubbish. If you have a COVID, you will spread COVID to all your family. So to keep your family intact, I will request that one should go for vaccination. And in India, it is free. Even Dr. Rughani, I will say, we are giving paid vaccine with the Apollo hospitals in Rajkot. And we are giving both vaccines, Covaxin as well as Covishield. So we almost daily, minimum 50 to 70 patients are getting vaccinated in our hospital. So that is why we encourage the vaccination, and to avoid COVID, to fight COVID, the cheapest shastra is vaccine. Yeah. So that is one thing one should do it, and get yourself vaccinated. That is my request to all. Don't avoid vaccine. That vaccine. Don't be afraid of vaccine. So please do it.
Thanks, Dr. Modha. This was
Yes,
great.
Ashok.
Next question I would like to take is about comorbid conditions like diabetes, hypertension, obesity. This all are leading to more issues, right, in your sexual life. So, any comments over there?
You want me to speak or?
Dr. Modha or Dr. Ashok?
Ashok, Dr. Ashok, please.
Okay, so the diabetes, hypertension, obesity leads to more sexual problems, no doubt about it. These are the leading cause. After the age of 40, many patients we see, and I did, my study hypothesis was sexual dysfunction amongst diabetes. Diabetes is #1 cause of erectile dysfunction in this world. Diabetes leads to 4 things. It reduces the blood circulation. It causes neuropathy. That means the nerves becomes damaged. Diabetes leads to endothelial cell damage. Now, endothelial cell of the penile tissue are the one which gets erection. If you have a damaged endothelial cells, it causes you erectile dysfunction. Damaged endothelial cells are not reversible at this time. So that's why people with long-term diabetes or hypertension have an erectile dysfunction, not reversible. So whatever remaining tissues you have, we need to keep it healthy, and to keep it healthy, get proper diet, exercise, and treatment. So diabetes and hypertension are the leading cause of sexual problems in this world. Obesity, same. These are the common cause. And depression is also one of the major factors in comorbid condition. And all these problems leads to even more COVID complications. That's the point. So it is related with COVID because as somebody who has been suffering from COVID with diabetes or hypertension or obesity, COVID infection increases. And the major cause of many patients with COVID infection is this comorbid condition. And that leads to erectile problem or sexual problem. So if you control, it helps you a lot in your life, so you can live happy and healthy life.
Correct. Especially in South Gujarat, I know, okay, even in dal, right, we eat like add sugar. In coffee, we will add like 4 spoons of sugar. And I tell like, nah, tame khao khand wadi dal, but try to avoid, use jaggery, right, instead of tamare mittu khau chai, then
Yeah,
try jaggery, right?
I agree with you. I think sugar is a kind of, in non-medical language, I could say slow poison.
Oh, wow.
In the sense when you eat excessive sugar and then you don't do exercise and then you eat and smoke and all these things. Unhealthy food.
Yeah.
Eat healthy food.
And someone just told me, I got depressed. I was like, are you working with a psychiatrist? No, I started drinking after depression. I'm like, what? You need to go and consult a psychiatrist. No, no, no. I think alcohol will help. In what way alcohol will help? I have no idea. I think
No,
it
see, when you drink alcohol, you might feel relaxed for a while, temporarily, but you are damaging your liver. I
Right.
mean, overall, excessive alcohol leads to damage of the liver, cirrhosis of liver or damage of the liver, and then other parts of the body. So, limited number or moderate amount of alcohol is fine. It helps. But what people think that, oh, let me just drink alcohol and then I sleep. But then you sleep for a few days well, and eventually you need more dose of alcohol to sleep well.
Right.
We are addicted to alcohol now. Instead of taking 2 packs, you will need 3 packs to sleep well, and then 4 packs to sleep well. So that is how the addiction causes problems.
I
So
see.
I would advise everybody to stick to limit and don't drink every day. Once in a while, once in a week, it's fine to drink 2 packs. That's okay.
Right. All right, our last question layer, we have to keep time in mind, and of course it's very late for all the doctors there as well. So the last question is, testicular damage leads to low testosterone, affects fertility and sexuality. What is your advice on that?
Okay, so the COVID infection we have discussed, but let me just go back again. The COVID
Yeah.
infection causes testicular damage.
Yeah.
Testicles are the very important organ in male. It functions. Testicular is the one which produces our testosterone sex hormone, and testiculars are the one which produces the sperms. So if there is a damage of the testicles after COVID infection, that causes less testosterone production. Less testosterone causes erectile dysfunction, loss of libido or less sexual desire. Even it leads to depression. It leads to even muscular, non-sexual issue. Like testosterone is also important part for bone and muscles, and to have a happy and healthy life. So hormone is also important part of our body. So when it has gone down, but fortunately, when you go and see a good doctor, they can check your blood, they can check your testosterone. Even if the testosterone level is low, you can be given medication to improve your testosterone. There are testosterone gel available, testosterone injections available, and other medicines available. So that affects your sexuality. And when you have a damaged testicles, it affects your sperm counts. We don't have long-term study about sperm counts, unfortunately, but short-term testicular low testosterone is the proved theory after COVID infection, and can be helped by medication if you see the right. Now, I will just advise that fenugreek, which is called in Gujarati methi.
Methi.
If you eat every day 1 tablespoon of methi, mixed with half glass of water, and then chew it in the morning, your natural testosterone level goes up long term. So methi is good for testosterone. This is scientific talk. This is not that I'm just talking, but scientifically it has been proved that if you eat methi daily, it releases your natural testosterone from testosterone is bind in albumin and globulin of the blood, sex hormone binding globulin. So if you eat fenugreek every day, it helps you a lot. So that is the medicine also we give, of fenugreek. But we have at home, which is cheap and free almost.
Yeah.
And it's good for digestion and some other, arthritis and other parts also. Fenugreek or methi. Well, eat methi, enjoy life, have good health, and enjoy life with your family and friends.
Excellent, Dr. Ashok. I think people asking questions on live show itself tells us that how productive the show is right today. So thank you so much. Again, we have covered all the important questions. And now I would request Dr. Modha to tell who is coming tomorrow on the show.
Yeah. Dr. Chetan Lal Setha is our ex-IMA president of Rajkot IMA, and he'll be talking on COVID and skin disease. So, Dr. Lal Setha will be coming tomorrow, but he will be coming at 7:30 p.m. The problem with him is a busy practitioner and he want to attend his OPD. So he said, I would like to join at 7:30. I said, okay, we'll help you. So 7:30. And day after tomorrow is that is on Saturday, our Swami Padmatmanandji. He will be joining at 6:45 because he had another program at 8 o'clock from USA. So you please be in touch with Swamiji.
Yes. Okay.
And whenever he wants to talk, please will allow him to talk.
Yeah, that whenever everybody. We are very accommodating, and in fact, I want to make an announcement that you can contact Dr. Ashok Rughani. His phone number is +91 94296 A lot of you I know will not ask questions on the live show. Currently, there is a taboo in India. કે પૂછાય ને બોલાય નહીં ને એ મને કઈ કોક કહી દેશે ને મારા સાસુ શું વિચારશે. A lot of people tell me, oh my God, what will my sasu think? I'm like, your sasu doesn't have to produce babies. She already gave you your husband. So it's your turn to, make her understand and educate probably even her. કે તમારા ટાઈમમાં આવું નહોતું. ખબર નહીં બધું કેમ થઈ જાતું હતું. But this generation is different.
હતું બધે હતું like that. people used to understand also in past, but they were not telling. They were not telling. But the friends and mother used to guide her daughter, and sometimes if son asked father, father used to guide. So it was there in previously. वर्षों से चली आती है. Only thing we are making it presentable with the help of Dr. Ashok Rughani and making the life simpler for the young couple, young people who had some problem they cannot talk to the friends or mother or parents. They will be guided well by Dr. Ashok Rughani.
Yes. So
So
please.
I'm thankful, Dr. Ashok Rughani,
Yeah.
and I'm very happy you have clarified so many things for the young people as well as for the elderly people also. So I'm very happy and thank you very much
Thank you.
for your kind advice and coming on our show. Thank you, Ashok. Thank
Thank
you
you.
very much.
Thank
Thank
you.
you,
Good night. Thank you for calling me. Thank you.
Hello.
Good
Thank
night.
you.